Amy Alton here. I'm an advanced registered nurse practitioner and a certified nurse midwife, also known as Nurse Amy. And you can find all of the kits that I review and today's kit, the dental kit, on store.doomandbloom.net. You can also find educational articles written by Dr. Joe Alton, my husband, a medical doctor, on doomandbloom.net. But today we're going to cover our dental kit. So first thing I want to do is show you what it comes in. We do have a couple of different canvas bags, but generally speaking, it will come in this. It has a clear front. We put a disclaimer in here. We also put some education because that's what we're into. And we will give you one of these Accel information sheets, and it will explain how to use a hemostatic gauze that actually will dissolve in the mouth. It's great for oral bleeding when you're pulling a tooth and you just can't control the bleeding with some gauze or some pressure. This might be something that saves a life. So, you know, bleeding in the oral gums can be very serious, especially when you pull a tooth. But anyway, it has great zippers. They are not going to break. All of your, again, supplies come inside this bag. This can be thrown into other backpacks. It can be kept in your bathroom. You can keep it in an RV if you're traveling, you're going somewhere far away, and perhaps you won't have access to a dentist. We also have people who travel with these who are going to, say, a third world, and they need to, you know, provide medical services for other people who don't have access to dentists. So this has been used in a lot of different scenarios, and we're really proud of it. And we did put this together in consultation with dentists, and we've had a lot of dentists review it, even people who have just bought the dental kit and taken it to their dentist and said, hey, is this a good kit? Is this, you know, really what I need? And they've all said yes, so we're really proud of that. Let's talk first the scary stuff. First, you're going to have some elevators, and these are what's going into the gum. It's going to loosen up the tooth when you have to pull a tooth. Many years ago, 50, 60, 70 years ago, the cure for a tooth problem was not filling it or root canals, it was removing the tooth. So going back to that scenario when you aren't going to have the fancy machines, you're not going to have the dentist with all of the technology that we have today, the cure for a lot of our tooth issues is going to be pulling the tooth. In addition to this education, let me just divert for 1 second. It does come with Where There Is No Dentist. That's an important book. That book reviews how you take care of dental issues, teeth in particular, in scenarios where you don't have the technology. So the book marries the kit perfectly. We did base the equipment on what's shown in especially the extraction section. So the instruments that you see are the exact ones that are in the book. So when you see you need X elevator or X extractor, this is what's in your kit. You can take care of that using the book, using what we have in the kit to take care of somebody with an emergency. You cannot practice dentistry without a license. So this is not something that you're going to want to do to your child or your neighbor or a friend who says, oh, I've got this tooth that's really bothering me. Can you take it out for me? Don't do it. If you have issues, if you have complications, and that person does seek modern medical care, and they say, yeah, my friend so-and-so pulled my tooth, you can get in trouble, so don't do that. Going back to the equipment, we have a 301, again, it's called an elevator. The other one is a 12B. Sometimes we have to substitute depending on the availability of this equipment, especially during the pandemic. We did have issues with getting exact equipment. However, what we did substitute worked just as well. It was maybe a slight variation on it, but it's the same instrument in whole, and it's going to be the same quality. We do have a 150, and I'm going to put in the video underneath exactly what these particular extractors are pulling. So we have a 150, we have a 151, we have an 18R and an 18L, and we have a 23. This is sometimes substituted for other things. This has been an issue getting this particular extractor. I'm not sure why 23s are so hard to get, but sometimes you'll get a different extractor. It won't say 23, but it is almost exactly what the 23 is, and it does do the same section of teeth. So that's how you're going to loosen the teeth and get the teeth out depending on where they're located. To take care of teeth, we do have a scaler and a scraper. Again, these are all dental office quality instruments. These are not knockoffs. These are from a dental office supplier, a big warehouse around here, and they have millions of instruments. It's pretty overwhelming, but we know this is what goes to the dental offices, so that's why I feel really good about these. This is a spoon extractor, and I'll show you a close-up on the video so you can see exactly what I'm talking about. It has a tiny little spoon at the end of each of these, and what this is good for is when you need to temporarily fill a tooth. We have given you zinc oxide and we have given you clove oil. And when you mix a drop or two of this with a little bit of this and you make a thick paste, we either give you pill cups or something called mixing papers, and you can mix them on there or inside the cup. You can use the spoon to mix that up. You can also use one of the tongue depressors, works really well too, to just mix it up. You're gonna make it a thick paste after you've cleaned out the area that you're going to be filling up. And it could be that if the filling they had fell out, and this is just a temporary fix until you can get to a dentist, and that's okay. Filling a tooth with a little clove oil and zinc oxide is not gonna get you in trouble. It actually might help the person prevent infection before they can get to the doctor. So it's okay to do. In long-term scenarios, when you think, okay, well, let's fill the tooth, let's see if, you know, maybe temporarily we can keep this from getting infected until maybe society comes back and the dentist is open again, you can use this. But you'll clean the tooth out really well. And one thing that's really good to clean the tooth out is hydrogen peroxide. I do not recommend hydrogen peroxide for inside of wounds. Some people do that, and I know when I was younger, that was one thing that we had done, but this kind of eats away a little bit of tissue. This is good as a mouthwash. You might want to mix it kind of 50-50 with some water, but hydrogen peroxide does kill bacteria, so before you're going to fill that tooth up, you want to use a little bit of hydrogen peroxide with a little bit of water, let it bubble out, clean that real well, dry it. We do have cotton tip applicators that will help dry inside, and then you're going to want to put that paste that you made with the clove oil and the zinc oxide inside of it. You're going to want to have them bite down. It'll shape the actual filling so that they don't feel it when they're biting down. And then take the excess, and you can take the scraper scaler that we give here, which just has two different shapes, to actually scrape off the excess of the filling that kind of squished out. So you want it to mold to the teeth, so when somebody bites, they're not feeling it, because if they're biting on it constantly, it's probably going to end up coming out. So you want it to really be shaped to the form of their bite. So we talked about the zinc oxide and the clove oil, these two instruments. We also have some tweezers. If you have somebody who does have a dental pain, something's uncomfortable, you can wet one of these cotton pellets, and there's about 50 or plus, 50 cotton pellets with a little bit of a clove oil. And that is as effective or more effective actually than an Oragel, which you do have in case you want to go ahead and use the commercially produced. But this is an analgesic. It will not take away the pain if you're going to pull a tooth. So don't think you can put clove oil in there and pull the tooth and they won't feel anything. That is not going to happen. You're going to be pulling a tooth with somebody who's begging you, please pull my tooth. I can't stand it. Please pull my tooth. I'm freaking out. So pulling the tooth is going to be something they're asking for, not like, hey, lay down, open your mouth, and I was just going to pull your tooth out. So anyway, the tweezers are good for putting the cotton pellets. We also have some scissors if you need to cut what we discussed before, the hemostatic. It's a 2x2, it's a hemostatic dressing. This is really great if you do pull a tooth. The bleeding is not stopped by putting a cotton roll between the teeth and having them bite, so pressure can stop bleeding. If the 50 cotton the cotton rolls are not working, then you may need to place the hemostatic dressing. But you may not put the whole thing in. It's 2x2, it's pretty big. You may need to cut just a little piece and go ahead and put that in with the tweezers. So these are what some instruments are for. These are not sterile. They don't come sterile. If we sterilize them, it probably wouldn't last anyway, and it's hard to pack them. You're going to want to clean your instruments before you use them. You're going to need to boil them in some water, steam them. Steaming is wonderful. There's a whole article on doomandbloom.net on how to steam instruments. Also in our book, the Survival Medicine Handbook, 4th edition, have a great section on how to take care of instruments and clean them. Worst comes to worst, at least use some alcohol. So I do have alcohol wipes here, and you know, clean as much as you can. Speaking of clean, before you touch somebody's inside of their mouth or any wound at all, use hand sanitizers or wash your hands, or wash your hands thoroughly, then use hand sanitizer. Put some gloves on. We do put 10 gloves in here, so you have a few pairs of gloves. We also put face masks, and this has nothing to do with COVID. These were in here when I created the kit with the dentist, gosh, probably 13 years ago. 12 years ago, but there are 10 masks in here, and really what you're doing is you're putting on that mask, so you're not breathing into the person's open wound, especially if you're pulling a tooth. So it's just more sanitary for you to put a mask on. You're leaning over someone's mouth. Who knows if you're harboring something and you're going to get this person sick. So just keep things clean, your hands, cover your face. That's a really good thing. We need to talk about some of the little stuff that's in here. We mentioned the cotton tip applicators, putting the paste in. This is also going to be able to dry the socket if you're cleaning out a tooth that you need to put the temporary filling in. There are 20 of these. There's 10 packets and 2 are in each. Again, if you need to examine somebody, we have some tongue depressors. Those are really, really handy for looking in the mouth. To keep teeth clean, again, you know, prevention is key. You don't want to get infections. You don't want to have to pull teeth. Make sure people are flossing. These are floss picks. They can get in between teeth really well. I also put dental floss in here. So you have 2 ways of getting between the teeth. You know, a simple thing, toothbrush and toothpaste. If you're in a survival scenario, most people are not packing toothpaste and toothbrushes. You may need to make sure that people are brushing their teeth, so we do provide that. If people are in pain, I do have a hot or cold pack. You need to cool this off or heat it. You know, you'll put it on the outside for you know, some care. Again, we do have the oral analgesic, again, for pain relief. I put ibuprofen in here. Again, reducing inflammation, helping with pain. We talked about the alcohol. There's also betadine wipes. We have, if you get a dental abscess, it's possible you may need to open it up, and we have a sterile scalpel in here to do that. To take a look, again, for examining when you're using the tongue depressor. A dental mirror, very important to see what's going on. It's not easy. A light source would be really great. If you had a headlamp, that would be really helpful so your hands are free to be able to examine inside. Also, to clean out the tooth, we talked about the hydrogen peroxide. You can use the 12cc syringe with either the hydrogen peroxide and water mix or just some water to flush really, really well in there. It's curved so it can get into the socket. While you're removing a tooth, you want to make sure the patient does not bite you. These are erasers. They're dental blocks. They're cheap and they're easy. So this is something you're going to place between the teeth so the patient's mouth stays open and they don't bite you when you're trying to pull something and you're causing pain. If you have an open socket and the bleeding has stopped and you feel like that wound is just really open, I know when I had my wisdom teeth out, they did put some stitches in. We do carry 4.0 Chromix inside this kit. There's 2 sterile ones. And I believe they're 30 inches of sterile suture on each of these. We do have a needle holder, so you can use this. Again, clean these up really well. Steaming them would be great. At least boil them, or at worst, just use some alcohol. But always clean these before you use them. And it's curved so you can get in there easier, and you know, just probably 1 stitch is enough. So I think I've covered everything. I will show you the picture of where there is no dentist, just so you can see that book. Again, it's included in here. We're really into teaching. The Axel information tells you exactly how to use the Axel inside the socket. And this is Nurse Amy. Thank you so much for watching. Really appreciate it. This kit can be found on store.doomandbloom.net. It is our dental kit. It may have two different names, First Aid Dental Kit and Survival Dental Kit. I do that because the ones that start with First Aid are the FSA and HSA friendly names of kits. So if you have those cards, you can buy my First Aid kits and you will be reimbursed, or you can use your card in the store. That usually works. Thank you so much for watching. We really appreciate. Here's the dental kit. Have a great day. Bye-bye.